Question 1. A client receiving IV vancomycin develops flushing, hypotension, and itching during infusion. What is the nurse's priority action? A. Stop the infusion immediately. B. Slow the infusion rate. C. Administer diphenhydramine. D. Notify the provider. Answer. A. Stop the infusion immediately. Rationale. These are signs of red man syndrome, a hypersensitivity reaction. The infusion must be stopped immediately to prevent worsening hypotension and shock. Question 2. A postoperative client reports shortness of breath and chest pain. Oxygen saturation is 88%. What is the nurse's first action? A. Notify the provider. B. Elevate the head of the bed. C. Obtain a stat chest X-ray. D. Administer prescribed pain medication. Answer. B. Elevate the head of the bed. Rationale. Elevating the head of bed improves oxygenation immediately while preparing for further diagnostic and medical intervention. Question 3. A nurse enters a room and finds a client seizing. What should the nurse do first? A. Place a tongue blade in the mouth. B. Restrain the client's movements. C. Turn the client onto their side. D. Call the rapid response team. Answer. C. Turn the client onto their side. Rationale. Turning prevents aspiration by keeping the airway clear. Calling for help follows after ensuring immediate safety. Question 4. A nurse caring for a client with SIAD notes serum sodium of 118 milliequivalent per liter. What is the priority nursing action? A. Restrict oral fluids. B. Administer loop diuretics. C. Prepare to administer hypertonic saline. D. Encourage oral sodium intake. Answer. C. Prepare to administer hypertonic saline. Rationale. Severe hyponatremia, less than 120, requires 3% saline to prevent seizures and cerebral edema. Question 5. A client with COPD is receiving oxygen at 4 liters per minute. The client becomes drowsy and confused. What should the nurse do first? A. Reduce oxygen to 2 liters per minute. B. Increase oxygen to 6 liters per minute. C. Notify provider immediately. D. Encourage deep breathing. Answer. A. Reduce oxygen to 2 liters per minute. Rationale. Excessive oxygen can suppress hypoxic respiratory drive in COPD patients, leading to CO2 retention and drowsiness. Question 6. A nurse is caring for a client with hyperkalemia who is receiving IV insulin and glucose. Which finding requires immediate intervention? A. Blood glucose 70 milligrams per deciliter. B. ECG showing peak T waves. C. Serum potassium 4.8 milliequivalent per liter. D. Urine output 45 milliliters per hour. Answer. B. ECG showing peak T waves. Rationale. Peak T waves indicate cardiac irritability due to high potassium. Immediate monitoring and correction are critical. Question 7. A client with Cushing's syndrome has blood glucose 420 milligrams per deciliter and confusion. What is the nurse's first action? A. Notify provider. B. Check for ketones in urine. C. Administer insulin as prescribed. D. Reassess in 30 minutes. Answer. C. Administer insulin as prescribed. Rationale. Elevated glucose with confusion indicates hyperosmolar state. Insulin prevents further complications. Question 8. A client with a central line develops sudden shortness of breath during dressing change. What is the priority nursing action? A. Call rapid response. B. Place client in left Trendelenburg position. C. Administer oxygen at 6 liters per minute. D. Flush the line with saline. Answer. B. Place client in left Trendelenburg position. Rationale. This position traps the air embolus in the right atrium, preventing it from entering the pulmonary circulation. Question 9. A client receiving total parenteral nutrition, TPN, has a blood glucose of 310 milligrams per deciliter. What is the nurse's best action? A. Stop the TPN immediately. B. Administer sliding scale insulin. C. Notify the provider. D. Decrease TPN rate by half. Answer. B. Administer sliding scale insulin. Rationale: hyperglycemia is managed by insulin. Stopping TPN abruptly causes rebound hypoglycemia. Question 10. A nurse observes a UAP repositioning a client with a chest tube connected to suction. The tubing becomes disconnected. What should the nurse do first? A. Reconnect tubing to suction immediately. B. Submerge the tube in sterile water. C. Notify provider. D. Apply occlusive dressing. Answer: B. Submerge the tube in sterile water. Rationale: placing the tube in sterile water maintains a water seal and prevents air from entering the pleural cavity. Question 11. A client with newly diagnosed diabetes states, "I can skip insulin if my glucose is normal." What is the best nurse response? A. That's fine as long as you feel well. B. Let's review how insulin controls your glucose levels. C. You must take insulin regardless of readings. D. You can skip it occasionally if you eat less. Answer: B. Let's review how insulin controls your glucose levels. Rationale: this response promotes therapeutic education using open-ended teaching rather than direct instruction. Question 12. A client post-op is restless, has HR110 and SpO2 89% on 2-liter O2. What should the nurse do first? A. Encourage deep breathing. B. Increase oxygen flow rate. C. Assess surgical site for bleeding. D. Notify provider. Answer: C. Assess surgical site for bleeding. Rationale: restlessness and tachycardia may indicate hypoxia secondary to hemorrhage. Assessing for bleeding is the priority. Question 13. A client with acute kidney injury has serum potassium 6.5 milliequivalent per liter and is receiving digoxin. Which action should the nurse take first? A. Administer digoxin as prescribed. B. Hold digoxin and notify provider. C. Encourage oral fluids. D. Prepare for dialysis. Answer: B. Hold digoxin and notify provider. Rationale: hyperkalemia increases risk of digoxin toxicity. The nurse should hold medication and notify provider immediately. Question 14. A nurse finds a client with tracheostomy coughing violently and the inner cannula dislodged. What is the nurse's first action? A. Call respiratory therapy. B. Insert the spare tracheostomy tube. C. Provide oxygen via stoma. D. Attempt to reinsert old tube. Answer: B. Insert the spare tracheostomy tube. Rationale: airway maintenance is priority. Reinserting the spare tube immediately restores airway patency. Question 15. A nurse is administering blood transfusion and notes chills, back pain, and hypotension. What should the nurse do first? A. Stop the transfusion. B. Notify the provider. C. Flush IV line with saline. D. Send blood sample to lab. Answer: A. Stop the transfusion. Rationale: these are signs of acute hemolytic reaction. The transfusion must be stopped immediately to prevent shock. Question 16. A client receiving IV potassium reports burning at the infusion site. What is the nurse's first action? A. Slow the infusion rate. B. Stop the infusion immediately. C. Dilute the IV solution further. D. Apply a warm compress. Answer: A. Slow the infusion rate. Rationale: burning is expected at high rates. Slowing prevents tissue damage while maintaining treatment. Question 17. A client receiving morphine PCA is difficult to arouse with RR8 per minute. What is the nurse's priority action? A. Stop the PCA and administer naloxone. B. Call rapid response. C. Increase oxygen flow. D. Notify provider. Answer: A. Stop the PCA and administer naloxone. Rationale: respiratory depression is a life-threatening opioid adverse effect. Naloxone reverses it immediately. Question 18. A client with liver cirrhosis reports confusion and tremors. What is the nurse's first action? A. Assess ammonia level. B. Encourage fluid intake. C. Prepare lactulose dose. D. Notify provider. Answer: C. Prepare lactulose dose. Rationale: Confusion and tremors indicate hepatic encephalopathy. Lactulose reduces ammonia levels rapidly. Question 19. A client with heart failure has gained 5 pounds in 2 days and reports dyspnea. What is the priority action? A. Restrict fluids. B. Assess lung sounds. C. Increase diuretic dose. D. Notify provider. Answer. B. Assess lung sounds. Rationale. Rapid weight gain suggests fluid overload. Assessing lung sounds identifies pulmonary edema early. Question 20. A client receiving chemotherapy has WBC count of 2,000 per cubic millimeter. What is the most important nursing intervention? A. Encourage fluid intake. B. Limit visitors and enforce infection control. C. Administer antiemetics. D. Encourage ambulation. Answer. B. Limit visitors and enforce infection control. Rationale. Low WBC indicates neutropenia. Preventing infection exposure is critical to survival. Question 21. A client receiving digoxin reports nausea and blurred vision with yellow halos around lights. What is the nurse's first action? A. Hold the next dose and notify the provider. B. Administer antiemetic. C. Encourage fluid intake. D. Document findings as normal. Answer. A. Hold the next dose and notify the provider. Rationale. These are signs of digoxin toxicity. The nurse must withhold the medication to prevent cardiac complications. Question 22. A diabetic client on metformin is scheduled for a CT scan with IV contrast. What should the nurse do first? A. Hold metformin 48 hours before and after the scan. B. Administer the contrast as prescribed. C. Check blood glucose level. D. Encourage oral hydration after the scan. Answer. A. Hold metformin 48 hours before and after the scan. Rationale. IV contrast can cause nephrotoxicity, increasing the risk of lactic acidosis if metformin is continued. Question 23. A client receiving heparin infusion has a PTT of 110 seconds. What is the priority action? A. Stop the infusion and notify the provider. B. Decrease the infusion rate by 50%. C. Continue as ordered. D. Give vitamin K. Answer. A. Stop the infusion and notify the provider. Rationale. A PTT greater than 100 seconds indicates risk for bleeding. The infusion must be stopped and evaluated. Question 24. A nurse is preparing to administer potassium chloride IV. What is the most appropriate nursing action? A. Dilute the drug and infuse via pump. B. Give undiluted as IV push. C. Infuse through a gravity line. D. Mix with dextrose solution. Answer. A. Dilute the drug and infuse via pump. Rationale. IV potassium must never be given undiluted or by IV push due to the risk of cardiac arrest. Question 25. A patient receiving morphine sulfate IV becomes unresponsive with shallow respirations. What should the nurse do first? A. Stop the infusion and administer naloxone. B. Increase IV fluids. C. Apply oxygen at 2 liters per minute. D. Notify the provider immediately. Answer. A. Stop the infusion and administer naloxone. Rationale. Naloxone reverses opioid-induced respiratory depression and must be given immediately. Question 26. A client prescribed warfarin reports new bruises and gum bleeding. What should the nurse do first? A. Check INR results. B. Increase green leafy vegetables. C. Give vitamin K. D. Stop the medication immediately. Answer. A. Check INR results. Rationale. Bleeding symptoms suggest excessive anticoagulation. INR must be verified before taking further action. Question 27. A nurse is preparing to give insulin glargine and regular insulin. What should the nurse do? A. Administer in separate syringes. B. Mix both in the same syringe. C. Give regular insulin first, then glargine. D. Delay glargine by 30 minutes. Answer. A. Administer in separate syringes. Rationale. Insulin glargine is long-acting and must not be mixed with other insulins due to altered absorption. Question 28. A client receiving gentamicin has a creatinine of 2.1 milligrams per deciliter. What should the nurse anticipate? A. Hold the dose and notify the provider. B. Increase the infusion rate. C. Administer as ordered. D. Give with fluids to protect kidneys. Answer. A. Hold the dose and notify the provider. Rationale. Gentamicin is nephrotoxic. Elevated creatinine indicates renal impairment and risk for toxicity. Question 29. A client on lithium therapy reports diarrhea and tremors. Serum lithium level is 1.8 milliequivalent per liter. What should the nurse do? A. Hold the medication and notify the provider. B. Administer next dose as scheduled. C. Increase sodium intake. D. Provide anti-diarrheal medication. Answer. A. Hold the medication and notify the provider. Rationale. Toxic levels greater than 1.5 milliequivalent per liter cause neurologic and GI symptoms. Withholding prevents worsening toxicity. Question 30. A patient on furosemide therapy complains of muscle weakness and irregular heartbeats. What should the nurse check first? A. Serum potassium level. B. Blood pressure. C. Blood glucose level. D. Intake and output. Answer. A. Serum potassium level. Rationale. Furosemide can cause hypokalemia, leading to muscle weakness and dysrhythmias. Question 31. A nurse is administering IV phenytoin. What is a key safety action? A. Administer slowly, not exceeding 50 milligrams per minute. B. Give as a rapid IV push. C. Mix with dextrose. D. Infuse via IM route. Answer. A. Administer slowly, not exceeding 50 milligrams per minute. Rationale. Rapid infusion can cause hypotension and cardiac arrhythmias. Question 32. A nurse finds a patient with a transdermal fentanyl patch drowsy and with pinpoint pupils. What is the nurse's priority action? A. Remove the patch and assess respiratory rate. B. Notify the provider. C. Apply oxygen. D. Give acetaminophen. Answer. A. Remove the patch and assess respiratory rate. Rationale. Fentanyl toxicity causes respiratory depression. Removal prevents further absorption. Question 33. A client prescribed MAOI asks if they can eat aged cheese. What should the nurse teach? A. Avoid aged cheese due to hypertensive crisis risk. B. It is safe in small amounts. C. Eat with milk to neutralize effects. D. Limit intake to once weekly. Answer. A. Avoid aged cheese due to hypertensive crisis risk. Rationale. Tyramine-rich foods interact with MAOIs, causing severe hypertension. Question 34. A client on prednisone suddenly stops the medication. What is the nurse's priority concern? A. Risk of adrenal insufficiency. B. Risk of hypoglycemia. C. Fluid overload. D. Weight loss. Answer. A. Risk of adrenal insufficiency. Rationale. Abrupt withdrawal suppresses adrenal function, causing hypotension and fatigue. Question 35. A client receiving nitroprusside IV develops confusion and hypotension. What is the most likely cause? A. Cyanide toxicity. B. Hypokalemia. C. Drug tolerance. D. Bradycardia. Answer. A. Cyanide toxicity. Rationale. Nitroprusside metabolizes into cyanide. Symptoms include confusion and hypotension. Question 36. A nurse is about to administer oral iron to a client. What should the nurse include in teaching? A. Take with orange juice. B. Take with milk. C. Take on a full stomach. D. Avoid vitamin C. Answer. A. Take with orange juice. Rationale. Vitamin C enhances iron absorption. Milk inhibits it. Question 37. A patient taking spironolactone complains of muscle weakness. What should the nurse assess first? A. Serum potassium. B. Serum calcium. C. Blood glucose. D. Sodium level. Answer. A. Serum potassium. Rationale. Spironolactone is potassium sparing. Hyperkalemia causes muscle weakness. Question 38. A client on levothyroxine reports palpitations and heat intolerance. What should the nurse do? A. Notify the provider immediately. B. Reassure as normal. C. Increase the dose. D. Give with antacid. Answer: A. Notify the provider immediately. Rationale: these are signs of levothyroxine overdose, indicating hyperthyroidism. Question 39. A patient receiving chemotherapy develops a fever of 101 degrees Fahrenheit, 38.3 degrees Celsius. What is the nurse's priority? A. Report immediately to provider. B. Administer acetaminophen. C. Continue monitoring. D. Encourage fluids. Answer: A. Report immediately to provider. Rationale: fever indicates neutropenia and possible sepsis, a medical emergency. Question 40. A client on clozapine reports sore throat and fever. What is the nurse's first action? A. Obtain WBC count. B. Encourage rest. C. Continue medication. D. Administer acetaminophen. Answer: A. Obtain WBC count. Rationale: clozapine can cause agranulocytosis. A WBC check is critical to prevent fatal infection. Question 41. A client receiving IV amphotericin B develops chills, fever, and hypotension during infusion. What is the nurse's first action? A. Stop the infusion immediately. B. Administer acetaminophen. C. Notify the provider. D. Slow the infusion rate. Answer: A. Stop the infusion immediately. Rationale: these symptoms indicate an acute infusion reaction. The drug must be stopped to prevent anaphylaxis. Question 42. A patient on amiodarone develops cough, dyspnea, and crackles. What should the nurse suspect? A. Pulmonary toxicity. B. Heart failure. C. Fluid overload. D. Pneumonia. Answer: A. Pulmonary toxicity. Rationale: amiodarone can cause pulmonary fibrosis. Respiratory assessment and medication review are urgent. Question 43. A client on ACE inhibitors reports persistent dry cough and swelling of the lips. What should the nurse do first? A. Hold the medication and notify the provider. B. Administer diphenhydramine. C. Reassure that cough is normal. D. Continue medication and monitor. Answer: A. Hold the medication and notify the provider. Rationale: swelling of the lips indicates angioedema, a life-threatening reaction. Question 44. A nurse is giving vancomycin IV. The client's trough level is 24 micrograms per milliliter. What is the best nursing action? A. Hold the dose and notify the provider. B. Continue as prescribed. C. Increase IV fluids. D. Monitor urine output only. Answer: A. Hold the dose and notify the provider. Rationale: a trough greater than 20 micrograms per milliliter indicates toxicity. Nephrotoxicity risk is high. Question 45. A client with Parkinson's disease taking levodopa reports new involuntary movements and facial grimacing. What should the nurse do? A. Notify the provider immediately. B. Increase the dose. C. Reassure as expected. D. Give the next dose early. Answer: A. Notify the provider immediately. Rationale: these are signs of dyskinesia, indicating peak dose toxicity requiring dose adjustment. Question 46. A nurse is caring for a client receiving IV magnesium sulfate for preeclampsia. The client becomes lethargic with absent deep tendon reflexes. What is the nurse's next action? A. Stop infusion and administer calcium gluconate. B. Decrease infusion rate. C. Reassess in 15 minutes. D. Notify the provider. Answer: A. Stop infusion and administer calcium gluconate. Rationale: these are signs of magnesium toxicity. Calcium gluconate is the antidote. Question 47. A client on metoprolol develops bradycardia, HR 45 BPM, and dizziness. What should the nurse do first? A. Hold the dose and assess blood pressure. B. Give atropine. C. Continue the medication. D. Encourage deep breathing. Answer: A. Hold the dose and assess blood pressure. Rationale: Beta blockers can cause bradycardia. Holding the dose prevents worsening hypotension. Question 48. A nurse administers IV potassium chloride through a peripheral vein. The client reports burning at the site. What is the nurse's first action? A. Stop the infusion immediately. B. Apply a warm compress. C. Slow the rate of infusion. D. Flush the IV line with saline. Answer. A. Stop the infusion immediately. Rationale. Burning indicates infiltration or extravasation, which can cause tissue necrosis. Question 49. A client receiving high-dose corticosteroids develops black tarry stools. What should the nurse do? A. Report immediately to the provider. B. Continue medication with food. C. Reassure that it is a side effect. D. Encourage hydration. Answer. A. Report immediately to the provider. Rationale. Tarry stools suggest GI bleeding, a serious adverse effect of corticosteroids. Question 50. A patient receiving IV nitroglycerin complains of a severe headache and dizziness. What is the nurse's next action? A. Check blood pressure. B. Stop the infusion. C. Administer acetaminophen. D. Notify the provider. Answer. A. Check blood pressure. Rationale. These are signs of hypotension. Verifying BP ensures safe continuation. Question 51. A client taking linezolid for MRSA infection is prescribed an SSRI antidepressant. What should the nurse do? A. Notify the provider due to serotonin syndrome risk. B. Administer both as prescribed. C. Separate doses by 2 hours. D. Monitor blood pressure daily. Answer. A. Notify the provider due to serotonin syndrome risk. Rationale. Linezolid combined with SSRIs increases serotonin levels, risking life-threatening toxicity. Question 52. A patient taking valproic acid has a new onset of right upper quadrant pain and jaundice. What is the nurse's first action? A. Hold medication and notify provider. B. Administer antiemetic. C. Encourage rest. D. Check blood sugar. Answer. A. Hold medication and notify provider. Rationale. These are signs of hepatotoxicity. Prompt discontinuation prevents liver failure. Question 53. A nurse is preparing to administer IV chemotherapy. Which PPE is essential to prevent exposure? A. Double gloves, gown, and face shield. B. Single gloves and mask. C. Surgical mask only. D. Cap and sterile gloves. Answer. A. Double gloves, gown, and face shield. Rationale. Cytotoxic agents require full protective gear to prevent occupational exposure. Question 54. A client on clopidogrel is scheduled for surgery. What should the nurse expect the provider to order? A. Discontinue clopidogrel 5 to 7 days before surgery. B. Continue until day of surgery. C. Administer heparin instead. D. Increase dose before surgery. Answer. A. Discontinue clopidogrel 5 to 7 days before surgery. Rationale. Stopping reduces bleeding risk during operation. Question 55. A patient receiving IV ceftriaxone reports shortness of breath and generalized hives. What is the nurse's first action? A. Stop the infusion immediately. B. Give epinephrine. C. Notify the provider. D. Apply oxygen. Answer. A. Stop the infusion immediately. Rationale. These are signs of anaphylaxis. Stopping the drug prevents further exposure. Question 56. A client prescribed carbamazepine for seizures develops fever and mouth ulcers. What is the nurse's immediate action? A. Obtain a CBC count. B. Administer antipyretic. C. Encourage oral fluids. D. Continue medication. Answer. A. Obtain a CBC count. Rationale. Carbamazepine can cause agranulocytosis, leading to infection. Question 57. A patient receiving IV lorazepam becomes drowsy with a respiratory rate of 8 per minute. What is the nurse's next action? A. Administer flumazenol. B. Increase oxygen flow. C. Notify the provider. D. Monitor level of consciousness. Answer: A. Administer flumazenol. Rationale: flumazenol reverses benzodiazepine-induced respiratory depression. Question 58. A client on methotrexate develops mucosal ulcers and fatigue. What should the nurse monitor closely? A. CBC for bone marrow suppression. B. Creatinine level. C. Blood glucose. D. Potassium level. Answer: A. CBC for bone marrow suppression. Rationale: methotrexate can cause myelosuppression, leading to anemia and infection risk. Question 59. A client on haloperidol develops high fever, rigidity, and confusion. What should the nurse do first? A. Stop the drug and notify the provider. B. Administer acetaminophen. C. Give diphenhydramine. D. Apply cooling blanket only. Answer: A. Stop the drug and notify the provider. Rationale: these are signs of neuroleptic malignant syndrome. Immediate discontinuation is required. Question 60. A nurse administers IV phenytoin through a line containing dextrose. The solution becomes cloudy. What should the nurse do? A. Stop the infusion immediately. B. Flush and continue infusion. C. Administer slowly. D. Shake the solution to mix. Answer: A. Stop the infusion immediately. Rationale: phenytoin is incompatible with dextrose. Precipitation can cause embolism and toxicity. Question 61. A patient in the ICU receiving IV norepinephrine develops cold, pale extremities, and a weak pulse. What is the nurse's priority action? A. Titrate down the infusion rate. B. Apply warm blankets. C. Flush the IV line with saline. D. Administer additional fluid bolus. Answer: A. Titrate down the infusion rate. Rationale: cold, pale extremities indicate excessive vasoconstriction from norepinephrine. Reducing rate prevents ischemic injury. Question 62. A client on IV nitroprusside for hypertensive crisis becomes restless and confused. What is the nurse's immediate action? A. Stop the infusion. B. Check blood pressure. C. Administer oxygen. D. Notify the provider. Answer: A. Stop the infusion. Rationale: restlessness and confusion may indicate cyanide toxicity from nitroprusside. Infusion must be stopped immediately. Question 63. A nurse is caring for a patient receiving IV insulin in the ICU. The patient suddenly becomes diaphoretic and confused. What should the nurse do first? A. Stop the insulin infusion and administer dextrose. B. Check potassium level. C. Notify the physician. D. Increase IV fluids. Answer: A. Stop the insulin infusion and administer dextrose. Rationale: symptoms indicate hypoglycemia. Rapid correction with dextrose is life-saving. Question 64. A patient on heparin infusion has a PTT greater than 100 seconds and complains of abdominal pain. What is the nurse's priority action? A. Stop the infusion immediately. B. Administer protamine sulfate. C. Notify the provider. D. Assess for hematuria. Answer: A. Stop the infusion immediately. Rationale: excessive anticoagulation increases risk for internal bleeding. Stop infusion first. Question 65. A nurse caring for a patient on IV dopamine notices extravasation at the IV site. What should the nurse do first? A. Stop the infusion and administer phentolamine to the site. B. Elevate the arm and apply heat. C. Flush the IV with normal saline. D. Notify the provider. Answer: A. Stop the infusion and administer phentolamine to the site. Rationale: dopamine extravasation causes tissue necrosis. Antidote phentolamine must be infiltrated locally. Question 66. A patient receiving propofol for sedation develops green urine and hypotension. What should the nurse do? A. Stop the infusion and notify the provider. B. Continue infusion and increase fluids. C. Reassure that discoloration is benign. D. Administer naloxone. Answer: A. Stop the infusion and notify the provider. Rationale: these are signs of propofol infusion syndrome. A rare but fatal condition requiring immediate discontinuation. Question 67. A client in septic shock on norepinephrine has a mean arterial pressure MAP of 55 millimeters of mercury despite fluids. What is the nurse's next action? A. Increase norepinephrine infusion per protocol. B. Give another fluid bolus. C. Start dopamine infusion. D. Check central venous pressure. Answer. A. Increase norepinephrine infusion per protocol. Rationale. MAP below 65 millimeters of mercury requires titration of vasopressors to restore perfusion. Question 68. A patient on continuous fentanyl infusion becomes unresponsive with a respiratory rate of 6 per minute. What should the nurse do immediately? A. Stop the infusion and administer naloxone. B. Increase oxygen and monitor. C. Notify the provider. D. Reassess in 5 minutes. Answer. A. Stop the infusion and administer naloxone. Rationale. Opioid toxicity causes respiratory depression. Naloxone is the antidote. Question 69. A client on IV lidocaine for ventricular dysrhythmia develops dizziness and slurred speech. What is the nurse's next action? A. Stop the infusion and assess cardiac rhythm. B. Decrease the infusion rate. C. Notify the provider. D. Obtain serum potassium. Answer. A. Stop the infusion and assess cardiac rhythm. Rationale. Neurologic symptoms indicate lidocaine toxicity. Stopping the drug prevents seizures and cardiac arrest. Question 70. A patient on IV mannitol for increased intracranial pressure has crackles and edema. What is the nurse's best action? A. Stop the infusion and notify the provider. B. Slow the infusion rate. C. Encourage fluids. D. Elevate the head of the bed. Answer. A. Stop the infusion and notify the provider. Rationale. Mannitol can cause pulmonary edema if it leaks into intravascular space. Immediate discontinuation is required. Question 71. A patient receiving IV digoxin has a potassium level of 2.8 milliequivalent per liter. What is the nurse's priority action? A. Hold the medication and notify the provider. B. Administer potassium supplement. C. Continue with close monitoring. D. Assess apical pulse for 1 minute. Answer. A. Hold the medication and notify the provider. Rationale. Hypokalemia increases risk for digoxin toxicity. Medication should be held until corrected. Question 72. A client in cardiogenic shock on IV dobutamine shows a new HR of 140 BPM and chest pain. What is the nurse's next step? A. Stop the infusion immediately. B. Administer nitroglycerin. C. Notify the provider. D. Decrease oxygen flow. Answer. A. Stop the infusion immediately. Rationale. Tachycardia and chest pain indicate excessive beta stimulation. Drug must be discontinued. Question 73. A nurse caring for a patient on IV insulin and potassium replacement notices peak T waves on ECG. What is the nurse's immediate action? A. Stop potassium infusion and notify the provider. B. Administer calcium gluconate. C. Slow insulin infusion. D. Check blood glucose. Answer. A. Stop potassium infusion and notify the provider. Rationale. Peak T waves signal hyperkalemia. Stopping potassium prevents cardiac arrest. Question 74. A client receiving IV nitroglycerin for acute coronary syndrome has BP 7848 mmHg and HR 110 BPM. What is the nurse's first action? A. Stop the infusion immediately. B. Elevate the legs and notify the provider. C. Administer normal saline bolus. D. Recheck BP in 10 minutes. Answer. A. Stop the infusion immediately. Rationale. Profound hypotension is a life-threatening adverse effect of nitrates requiring immediate discontinuation. Question 75. A patient receiving IV morphine for chest pain becomes unresponsive with pinpoint pupils. What is the nurse's next action? A. Administer naloxone and monitor respiration. B. Stop the infusion and call a rapid response. C. Increase oxygen and wait for provider. D. Reassess pain level in 5 minutes. Answer. A. Administer naloxone and monitor respiration. Rationale. Pinpoint pupils and unresponsiveness indicate opioid overdose. Naloxone reverses respiratory depression and CNS suppression. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.